How a young girl lost her vision to the flu. A girl from Midwestern U.S. state of Iowa lost her vision from a serious bout of the flu in December 2019. The 4-year-old, Jade DeLucia, caught the flu several days before Christmas as a result of her not being vaccinated for the flu this season. She spent almost 2 weeks in intensive care at the University of Iowa Stead Family Children's Hospital. Her doctors say she's lucky to be alive. According to the U.S. Centers for Disease Control and Prevention, many children die from the flu each year, usually because they don't get their flu shots. DeLucia was perfectly healthy before she caught the flu. On December 19, her mom realized she wasn't feeling so well. Her family thought it was nothing but a case of the bug, so they would give her medicine to bring her fever down. It went on until December 23. On December 24, DeLucia's father went to wake her up, but he found her unresponsive with a high fever. At the hospital, she had a seizure. On December 25, the doctors told the DeLucia family that the flu had inflicted brain damage on their little girl in what is known as encephalopathy. A pediatric neurologist diagnosed their daughter with acute necrotizing encephalopathy, or ANE, which is caused by a viral infection. On January 1, DeLucia woke up, opened her eyes, squeezed her family's hands, and smiled. They then realized that she was having trouble seeing due to her brain, not her eyes. Her neurologist said DeLucia's recovery at 6 months is likely all she's going to get. She may also develop learning disabilities. Doctors say that although the flu vaccine may only be around 40 to 60% effective at preventing the flu, that isn't the main reason children should be vaccinated. It is important to vaccinate one's children to prevent their chances of contracting complications of the flu. DeLucia has since been able to walk without holding walls, which means she has regained her sight. However, her ophthalmologist has yet to assess her progress and how permanent it is. Encephalopathy is characterized by mild to severe symptoms, from memory loss to death. ANE is a type of rapidly progressing encephalopathy that is severe and very rare. ANE is usually diagnosed in children, but teenagers and adults can develop it as well. First coined in 1955, ANE occurs soon after a patient has a viral infection. ANE presents itself in various ways, with the first few symptoms being related to the viral infection the patient has. The patient may develop a fever, cough, diarrhea, sore throat, rash, and vomiting. The patient would then experience rapid neurological deterioration within just a few days, through seizures and different stages of consciousness, with the worst stage being a coma. Using brain scans and cerebrospinal fluid testing, and with the knowledge of the viral infection, doctors can diagnose the patient with ANE. According to ANE International, it is believed that ANE is an immune-mediated process, which means people who have ANE might have exaggerated immune responses to their infections. Most survivors of ANE experience epilepsy, motor deficits, and other types of delay.